Right, hi everyone. Can you hear me okay? Perfect. Okay, so I'm going to give you a bit of a whistle-stop tour today of a report that the Psoriasis Association has been working on for about the past 18 months and was finally published in February this year. So it's called More Than Skin Deep, The Underlying Burdens of Psoriasis and Psoriatic Arthritis. It was commissioned by Novartis Pharmaceuticals and it was produced by a company called Wilmington Healthcare and there was support from another company called M&F Health. Oh, sorry, I just realized I've got my own clicker here, so I can move the slides on myself. Perfect. Okay, so what is the report? Who's the audience? So the report is aimed primarily at policymakers, healthcare professionals and NHS commissioners, so people who have the ability to make the decisions and affect change. It aims to set out the challenges that are currently faced by people with psoriasis and psoriatic arthritis, both in terms of day-to-day challenges, but also challenges of accessing the care and treatment that they need. So it aims to raise awareness and improve the understanding of the impact of both conditions, identifying the personal impact, socioeconomic impact, but also the impact on the NHS in terms of the time and resource spent on treating and managing psoriasis and psoriatic arthritis. The report provides a number of key recommendations to affect change. And that's why it's important, because it aims to move psoriasis and psoriatic arthritis up the healthcare agenda. And by providing practical recommendations, then hopefully it's something that policymakers can act on to help implement these changes. So the report, as I say, was commissioned by Novartis. It was written by Wilmington Healthcare, but we're lucky to have an expert working group who fed into the report and were able to draw on people with a range of expertise. So we had an MP involved, Sir Paul Beresford, who's the former chair of the All Parliamentary Group on Skin, so he's well across this topic area. We had 3 dermatologists involved in the report, so that's Professor Chris Griffiths, Professor Jonathan Barker, and Dr. Tivi Maruthapu, who's actually here with us today. And Tivi's actually got her own stand promoting another study, Psoriasis Association funded study that she's currently running, so I do have a chat with her today. We have a rheumatologist, Professor Stefan Ziber, who's involved as well. We also have a pharmacist, Anusha Patel, Sarah Copperwheat from the British Dermatological Nursing Group, and then a representation from the Psoriasis Association and Versus Arthritis to help feed that patient voice into the report and ensure that the experiences and priorities of people living with psoriasis and psoriatic arthritis were represented in the report. So the report methodology, so the findings are based on the opinions gathered through a workshop that was held with members of the expert working group back in 2020. So everyone had the opportunity to feed in their own opinions and experiences based on their day-to-day work with people with psoriasis and psoriatic arthritis. Wilmington carried out desk research to gather quantitative and qualitative data to support the report. And there was also analysis of online commentary. So that was looking at things like discussions in the Psoriasis Association's forums, general discussion about psoriasis, psoriatic arthritis on social media to see what topics were coming up, what people's main concerns were, what the issues are that are facing people with psoriasis and psoriatic arthritis day to day. The report was drafted and edited over the course of 2021, and it was finally published in February of this year. So the important part then, the recommendations. So the recommendations, there's 9 in total, and they're split into 5 general topic areas. The first of which is prioritising psoriasis and psoriatic arthritis as interlinked conditions. So recommendation 1, to raise awareness of psoriasis and psoriatic arthritis as interlinked conditions. So I think I would have thought most people in this room would probably agree that both conditions have been somewhat neglected over the years, particularly psoriasis. I think people who don't have the condition, there's probably a misconception that it is just a skin condition. We know in reality it's a chronic inflammatory disease, as is psoriatic arthritis. There's much more to psoriasis than just the symptoms on the skin. And this needs to be recognised within healthcare and by policymakers if they're to understand what the needs of people with psoriasis and psoriatic arthritis truly are. Recommendation 2 is prioritising early diagnosis and treatment of both psoriasis and psoriatic arthritis. So we know that early diagnosis is important. The quicker you can get a firm diagnosis and be started on an effective treatment, the more chance you have of preventing your psoriasis from flaring up and becoming more of an issue for you to deal with day to day. It also helps to prevent the comorbidities that are associated with psoriasis, psoriatic arthritis being the most prominent and common of those, but there are other comorbidities too. Obesity, there are some links with cardiovascular disease, fatty liver disease. And so getting people onto an effective treatment sooner can help prevent these comorbidities from occurring. Mental health conditions is another one. So the longer you are living with uncontrolled and managed psoriasis or psoriatic arthritis, the more impact this is likely to have on your life, and this can build up over time and become a problem. So the next section is optimizing service planning. So using data to understand local populations and establish a population health management approach to care. Now, what this really means is understanding within any given local area roughly how many people are living with psoriasis and psoriatic arthritis, what their current experiences of care are, what their needs are, because unless you have this data, unless you ask these questions, then you're guessing. You don't know. You don't know what the needs are of the people that you're trying to provide services for. So establishing this and giving people sound evidence to work from is really important. Recommendation 4 is to support the development of integrated care pathways. And this really means bringing together primary care and secondary care to work and communicate better, to stop this effect of you're being treated by your GP and then you move on to be treated by your specialist, but there's no communication between the two. We want people to have that joined up care between primary and secondary care. The next topic area is empowering people with psoriasis and psoriatic arthritis. Recommendation 5 is to ensure people living with psoriasis and psoriatic arthritis have a voice within new models of care. Currently, the NHS is undergoing structural changes which involve the setting up of integrated care systems which will provide healthcare locally. This is an opportunity for voluntary organisations, patient groups such as the Psoriasis Association, to have a seat at the table and to be able to feed in the things that people with psoriasis, psoriatic arthritis, what they want to see in terms of service design and delivery. Again, we think it's important that patients are involved in shared decision making, that services shouldn't be designed and then given to patients without involving them in the construction of the services in the first place. By involving the people who are going to use the services at the end of the day, you're much more likely to deliver things that are relevant and needed by the people who are going to use them. And ensuring access to education and self-management of self-care for patients. So I know standing here today that over the years, the Psoriasis Association has produced a lot of resources to help people self-manage their condition. I know other patient groups have done the same, pharmaceutical companies. There are loads of resources out there. How do we get these resources into the hands of the people who need them? And why aren't people being signposted to these resources when they're first diagnosed? It's not good enough to be told you have psoriasis, this is your diagnosis, there's no cure, go on your way. There's no excuse for not directing patients to the wealth of resources that are out there. So we want to see more of that. Supporting the workforce. So improving education and awareness of both psoriasis and psoriatic arthritis disease complexity. This is equally applicable to both people living with the conditions and healthcare professionals who are treating them. So as I just alluded to, when people are first diagnosed, we think it's important that they are told the full extent of what it means to live with psoriasis, what it means to live with psoriatic arthritis, what the condition is, the impact it could potentially have on your life, and therefore what support resources are available. For healthcare professionals, fully understanding the impact of psoriasis, psoriatic arthritis is vital, because without that understanding, you're not necessarily going to be in a position to provide the care and the support that your patients need. And supporting service redesign and innovation by the inclusion of the wider workforce in dermatology. So this connects back to a point I was talking about earlier. Better communication between primary and secondary care, looking at which other healthcare professionals can feed in and help with the provision of care to patients in the secondary setting. And the final recommendation from the report is to ensure widespread understanding and recognition of the socioeconomic implications of psoriasis and psoriatic arthritis. So this really comes back down to the wider understanding of what psoriasis and psoriatic arthritis are within society in general. There are various contact points we'll have in our lives, various stages of life that we go through: school, work, socializing with family and friends. And unless people in each of these settings understand what it means to live with psoriasis and psoriatic arthritis, again, the optimum support can't be provided. Whether that's teachers in a school understanding that the needs of a teenage girl living with visible psoriasis will be different to that of her classmates, whether it's a workplace understanding that if you've got a 10-week course of phototherapy, 3 appointments a week, you're going to need a bit more flexibility from your employer than perhaps other people who don't have that to factor in. So understanding the implications of living with psoriasis, psoriatic arthritis, making sure that people in all areas of society are aware of this, that's a key aim of this report and a recommendation. So what next? The report's been published, and that's the first step, getting it out there, but now we need people to interact with it. We need to get it in front of the people who can affect change. So online, using social media to spread the word of mouth, using events like this to let people know that the report's there, what the recommendations are. There's going to be a parliamentary launch event for the report, which we've been trying to get off the ground for some time. The last attempt clashed with the Queen's speech, which I think was a fair excuse for that not going ahead. But next month, we're hopeful we'll finally get this event underway. And so that will be a real opportunity to get these recommendations in front of MPs and policymakers. And then we have to monitor the progress. So we put these recommendations out there, but we want to see change. So how can we tell whether the recommendations have been adopted? If things aren't changing, why not? If we're going to produce more reports in the future, we want to know that the recommendations are going to be engaged with. So it's really important to monitor that progress. If you'd like to read the report yourselves, it's available on our website. So there's a link here. I don't know, it might be possible to put that in the Zoom chat. And there's also a QR code. So if you to scan this, it should take you to the report directly. So yeah, that's a nice bit of light reading for the break. And that's it from me. So thank you very much for listening. I hope it was interesting, and happy to take any questions if we have time.